Hello and welcome to The Nation. You're joining me, Elane, Noor, Abdullah, right here on Banama TV as we address the latest concerns developing in the COVID-19 pandemic, the latest variant, Omicron, another threat from vaccine inequality. Now, the Omicron variant was first reported to the World Health Organization, or WHO, from South Africa on the 24th of November 2021. And on the 26th of November 2021, the WHO designated it as a variant of concern and named it after Omicron, the 15th letter of the Greek alphabet. Now, the variant has an unusually large number of mutations, which has led to concerns regarding its transmissibility, immune system evasion, and vaccine resistance. So today we discuss the available information and the latest development of this new variant of concern with Professor Dr. Jamalluddin, Rahman, an epidemiologist, as well as Peter Nicol, our crisis management analyst. Hello, gentlemen. Welcome to the show. Now, let's shed some light on this Omicron variant. Doc, can we start off with you? Perhaps you can tell us what we know and what we don't know about this new variant.
I think by now we already know about. I won't say we know a lot about Omicron, but basically by now we know what are the same things that most of the world know about Omicron. But however, I would like to clarify a few things. One, Omicron has been reported by South Africa. So we believe that, or many experts believe that Omicron is already circulated around the world since October. So normally when we have high suspicion, then we do the test. We try to discover the variant. That's why South Africa is one of the countries that has a good epidemiological and surveillance system. So they pick up the variant and they reported it to WHO. And based on the number of mutations, as you mentioned, so WHO quite worried about it and classified it as a variant of concern. When you talk about variant of concern, by now we know already it involves three different things. One is about transmission. They will increase transmission, number one. Number two, it may increase the severity of disease, right? Disease. Number three, it can evade our immune response or those response based on for the vaccines. Because of that, WHO classified it as VOC. However, until today, when we look at the statistics, looking at those, especially in South Africa, obviously, we can see that the number of cases accelerated very, very high. Data are showing that the transmission is a doubling time. Doubling time means if previously 10 cases, and how many it becomes 20 cases, doubling time. Doubling time for Omicron at the moment is around 1.5 days compared to Delta, which is around 2 to 3 days. So it shows the transmission is high at the moment. Data so far quite consistent that transmission is high. However, if you look at the same statistics, you look at the number of deaths, still maintain quite low in South Africa. So despite the high transmission, the death rate is low, and it is consistent with the many reports, especially anecdotal reports with regard to severity, which is very, very mild. So we have some information which is a concern. Transmission is very high. However, at the same time, we also quite relieved because at the moment, number of severe cases and deaths is low.
Right. Pete, would you have anything to add to that?
I think Professor's covered everything that we know. I think what we do know is that we don't really know very much about it. It's likely to be about another 14 days or so before we have some clarity. But we do know that its spike protein contains mutations known to increase the transmissibility of the virus. There also seems to be some additional changes that mean that antibodies that are induced by the vaccines that we have or infection from other variants seem to be less effective in preventing infection with Omicron, suggesting that the virus may resist some aspects of the immunity that we have to protect.
Okay, with regard to the mutations, of course, certain mutation which are found in the current Omicron also present in the previous Alpha and Delta, and those particular mutations are related to severity and transmission. However, we must take note that we do not know whether, because the previous mutation is happened in isolation. So now when you have different combinations of mutations, we are not really sure whether one can nullify the effect of the others. So in a complex situation, in full pictures of the sequence, we do not really know at the end of the day the complete picture of this variant really causing higher severity or not. We do not sure yet. We have to wait for 2 weeks. People are saying about around 2 weeks for us to see the data.
So at this
Yeah.
point of time, which of these mutations are still of concern, and is there any evidence that Omicron produces these less severe diseases than previous variants? I know you guys did mention that you have to wait 14 days, but what's coming out of whichever research that is available to us at this point of time? Are we still concerned about Delta mainly?
Yes, at the moment, the one that rampaging the world is still Delta. So there's an issue here. Are we looking at Delta going down and replaced by Omicron? If Omicron is less severe, I'm quite happy. Even though the transmission is very high, but then if the severity is very low, so and then Omicron is replacing Delta, I mean, if I can choose lah, I would say I'm quite happy in that sense.
Right.
However, we are not sure whether Omicron is really milder compared to Delta. Those you have to be very careful about that.
Right.
Yeah, I
So
mean, the significant data on the seriousness of this is really not available at the moment. So we really don't know. But initial reports are suggesting that, as Professor says, symptoms are mild when compared to the rest. But there's a new South African study just released earlier today. It's not been peer reviewed yet, but it's found that Pfizer BioNTech vaccine actually may be up to about COVID strains that we're aware of. But Omicron's ability to escape vaccine antidotes appears to be incomplete from this study. But initial data suggests that it does make people less sicker than the Delta and other strains. So it's still a bit of a mixed bag as to just how severe this thing actually is.
right. So right now we don't have complete data, complete information with regards to how this Omicron is developing and mutating and evolving, and we'll have to wait a little bit for the next couple of weeks for this to sort of pan out. Now, the South African doctor who was one of the first to suspect a different coronavirus strain among patients said that symptoms of the Omicron variant were far milder and could be treated at home. And of course, Singapore recently announced people suspected of having the new Omicron variant will be isolated until doctors are confident that they are no longer infectious through repeat testing. What would you suggest our government do with regards to handling Omicron here? Let's start with you, Pete.
We know that the variant is here and probably transmitting in the community. So a credible scenario is that it could displace Delta in Malaysia and at a significantly faster rate than Delta displaced the other variants to become the dominant mutation. Remember that it appears to be generally asymptomatic and is only currently discovered after the genome sequencing or actually looking for it from COVID positive tests at the time. So the lessons learned in the management of this crisis will be seriously critical here. The lessons learned about limiting travel, specific targeting on travel restrictions, continued testing and quarantine, as we're seeing going into place now, have been effective in managing its arrival. But Malaysia certainly needs to get its booster program rolled out really fast, as we saw with the first and second inoculations. In this type of crisis, Elane, it's really straightforward. You need to react quickly and you need to go after the virus because you need to stop the chains of transmission.
Right. Prof, what do you have to say about how we can manage the virus here in Malaysia?
If you ask me, we already expect that there's going to be variants from COVID-19. There will be.
Yeah.
In fact, Omicron will not going to be the last. We mentioned already, Delta won't be the last, and now we have Omicron. So Omicron also not going to be the last. And we are not happy that the transmission, based on the preliminary data, that transmission is very high. We are not happy about that. However, we are quite relieved when the severity is low. Those are important facts. Okay, now, based on that fact, how should we react? For personally, I don't believe in travel ban. One, because as I mentioned just now, we believe that Omicron has been all over the world already. So it depends on whether you want to sequence it, you want to find it or not. So now we are looking for it. We are going to get it. We are going to see it. Having said so, in many countries, America, UK, for example, they have seen in a local transmission. It means that the Omicron is already in the community. And if it is true, Omicron has been around since October or early November till today, are we seeing higher death rate now? I don't think so. I don't think so. Transmission is higher because in Europe, for example, they suspect because of winter rather than because of new variant. And if it's already circulated in the community and it is very severe, so we should see a lot of higher death rate, just like we see in Delta, for example. So we should be seeing that, but at the moment we are not seeing it. So there's some positive, for me, some positive um, situation lah in terms of Omicron. And because of that, for me, the usual SOP, the usual public health measures still important. So I think for me, just do a lot of testings, and then I really applaud the government decision to do daily testing for our visitors. That's better than you just simply close your border to many countries.
Right.
I think the question is obviously, and Professor's right. I mean, how worried should we be? That's the question. So we need to be prepared. We need to be cautious, but we don't need to panic about this, because we are in a very different situation to where we were a year ago, when Delta stormed onto the scene. But for this new part of the ongoing crisis, it's clear that countries must prepare in their potential for any new surges connected with this faster transmission from Omicron. But the lessons learned from the spread and handling of the Delta variant absolutely still apply. Everything that we're doing, we still have to continue to do.
Right. Thank you for shedding some light on Omicron. When we come back, let's talk about how we can manage this. We'll take a short breather right now. When we go back after these messages, we'll have more information with Omicron. Stay with us. Hello and welcome back to The Nation. You're still with me, Elane, Noor, Abdullah today, as we discuss the topic of Omicron, another threat from vaccine inequality. Joining me in conversation today is Professor Dr. Jamalluddin, Epidemiologist, as well as Clinical Crisis Management Analyst. Gentlemen, earlier we spoke about what is Omicron and what are the current measures in place and what are the concerns. Now let's go on to the next question. The threat posed by this new variant, it shows what a perilous situation the world is in. The variant started from South Africa, or was reported from South Africa, which we know included in the list of countries that do not have full access to vaccines, despite the repeated warnings of health leaders. Failure to put vaccines in the arms of people in the developing world is now coming back to haunt us. Now, we were, of course, forewarned, and here we are. Do you think that this is a consequence that all of us will have to bear when rich countries are hoarding vaccines? What are your thoughts? Pete, let's start with you on this.
The issue of the lack of vaccines to poorer countries is a major risk and threat crisis point in fighting this pandemic. The reality is that really that no matter how well individual countries are protected, if your neighbours are not, then the risk remains to be a nationalistic issue or a political bargaining chip on the international stage, as we really are, all in this together.
Exactly. Now, Prof, what are your thoughts on this? How can we combat this and handle this?
Yeah, because we have to remember that the longer the virus in the body, the more likely the virus to mutate. So if we are not able, if the country, for example, not able, like most countries in South Africa, for example, their vaccination coverage is less than 30%, compared to the national world figure, average around 40%. So they are below even the world figure for vaccination coverage. Of course, obviously, it is not just the vaccines availability. There's a lot of other factors with regard to those countries. But once you do not have enough people who are being vaccinated, and once they have the COVID-19, they have more prolonged disease. So there's a lot of mutation possibly happen, even though we are not sure whether the variant originated from South Africa. We're not sure. But obviously, it is found in science. We know that immunocompromised individual, for example, those who cannot shed the virus very fast, so the virus stays longer in the body, keep on replicating. So along the way, they make an error So that's the error. Sometimes can be good, can be bad. That's contribute to the variant. So because of that, yes, very vaccine equity is very important. We have to help out all the countries. So the mantra people are saying, no country is safe until every country is safe. It's very
Yes.
true. So those are the things I think we have to help each other. I think what Malaysia has been doing, for example, like sharing their vaccines with Bangladesh and few other countries. Those are noble effort. Definitely, for more countries should do that. I think we are not able to end this pandemic if we being very selfish.
Right, we're all in this together. If we do not connect, if we do not help each other, this will prolong and go on as long as you mentioned earlier, nobody is safe until everybody is safe. Now, several countries have now temporarily banned travel from several southern African countries where this variant has been found. A move, of course, slammed as a knee-jerk draconian reaction by South Africa's health minister when they were the ones that revealed the existence of a new variant as what Antonio Guterres called as travel appetite. Now, do you think it's an unnecessary panic or it's the best step to take for now, considering that we have the instruments for safe travel? Prof, let's start with you, Prof.
When they praise South Africa for notifying about the variant and later shut their border to South Africa, I'm not sure what term I can use for such countries. But then what else we can do? What else we can do, isn't it? So I'm not sure whether that's a knee jerk, that's really the best measure we can protect our country. I'm not sure. Seriously, I'm not sure. I prefer if we don't, of course, especially initial, when once the WHO classify Omicron as VOC, immediately the country is very shocked. Even though Tedros says that you don't panic, but once you put something like that and mutation more than 30, double than what the Delta has, people scared, right? So I think what Pete mentioned just now, fear drive the policy now. I'm not sure the differentiate. I think Pete should be better than me to differentiate between the preparation, prevention, and being scared. So which one I'm not really sure, but I think the testing is important. If you do not block or ban certain countries to enter our country, at least do a good testing. So those are, I think, still important for us to prevent transmission. So rather than we immediately ban every country, now we have more than 40 countries. So shall we ban Singapore as well, for example? Are we going to do that? But we ban, but we open Langkawi. I'm not really sure what we are doing. So those are the things I think we should be. Very difficult for me to say what would the best. If I'm looking after the country, I may also impose the same ban. But however, uh, um, liberalization of testing is very important. So those are the things for me we can improve further, inshallah.
Pete, I think this is where you come in. What are your thoughts on this, Pete?
Yeah, absolutely right. One of the things, as I said, in emergency and crisis response is that if you believe that you need to be right before you move, you're never actually going to win. The problem is that people tend to be afraid, to make a mistake, afraid of the consequence of error. But the greatest error actually is to be paralyzed by the fear of failure. So the key to this really is about South Africa and the other countries. There is a credible threat coming out from those things. And the evidence suggests that their intention of the various governments is genuine. They're trying to respond correctly without going overboard with it. I mean, the temporary ban is actually a previous, tried and tested protocol. Use importation of the variant, or that's the idea behind it, whilst you allow your country to focus on dealing with the domestic surge. So what it is to buy time. I don't believe it's a knee-jerk reaction at all. It's probable that they've got it right with this. People will disagree with the travel ban. There is the thought, as Professor has said already, that this particular variant has been in countries for at least 6 to 8 weeks, maybe longer. But doing something now with that particular ban, and it's a targeted ban and it's a temporary ban, is a pretty good crisis protocol. The other thing really is that we've got to help manage any further importation of the variant. while these guys and while all countries try to manage any sort of domestic surge, because we know it's significantly more transmissible. And if that is the case, we know that we are seeing significant increase in hospitalization in South Africa, particularly for those who help manage it. This type of thing could help manage, pressure on health services in individual countries by trying to stop any further importation of this particular variant.
Right. Now, I'll go into the last question because we have about maybe 4 minutes left. Now, according to Dr. Fauci, one of the frustrating aspects of the logistics capability of getting vaccines into people's arms in South African countries and in other low to middle income countries is really very difficult. So it's not just about vaccine availability, but also about making that available within their own countries. And according to Dr. Anthony Fauci, many of the doses that have been shipped have not been used. And other African countries on the African continent have actually told them not to ship any more vaccines because they have not been able to adequately utilize it. So what are your thoughts on these issues that have been surfacing? Prof, perhaps you can share your thoughts on this.
As I mentioned just now, this is not something new. COVID-19 just amplified the baseline or the background issues or the main problem that's happening in African countries. So this is not something new, seriously. So, but then use this pandemic, this opportunity for us to try to help those countries, and we might not be able just to solve Omicron. So why don't we look into our neighbors, and then we look what do they need, so and then we help them not only by giving them vaccines, but the whole complete service, the healthcare services or programs, so that we can help them. If we can't help them in total, at least we can assist them in something. So those should be the spirit from all the countries, all of the world. So without that, I think we are not able to move forward. But I think at the same time, African countries also have their own issues, the political instability. I believe those are the challenges that they are facing. So there are things that we can do. There are things that I think those countries in Africa also must do something so that they help each other.
Right. Pete, what are your thoughts on this?
Yeah, absolutely. In a crisis of this magnitude, I mean, first of all, no government is going to admit its limitations. I mean, even if there is overwhelming evidence that those limitations are real. And that's down to, reducing and managing the fear factor in populations. I think in terms of the crisis mitigation, that the G7 missed a vital opportunity to actually support those countries. They need to develop their own vaccine producing facilities, rather than looking at providing them with just their own oversupply of vaccines, because that would have allowed them to produce quantities that they need in line with their logistical capabilities, and obviously formulate a very strong supply chain from production to actually getting vaccine in the arms. So it allows, individual governments the ability to control and supply out with the need to order and wait and hope for delivery of vaccines for their populations.
So at the end of the day, I think we need a bigger picture. I think we need to have more comprehensive assistance, not just like you mentioned earlier, just handing out vaccines and hoping that it's going to get to the population one way or another. There needs to be a little bit more of a full service provided, or education or assistance with regards to making mass vaccination a reality in these areas and in these countries. Now, thank you both for sharing this pertinent information and updates on this topic. I think it has enlightened quite a few people and perhaps allayed some fears with regards to Omicron. We were speaking to Professor Dr. Jamalluddin Rahman, Epidemiologist, as well as Nicol, Crisis Management Analyst, on the topic of Omicron and other threat and vaccine inequality. Now, the world can expect to learn more about the Omicron variant in the next couple of weeks. In the meantime, vaccines remain the best public health measure to protect people from COVID-19, slowing transmission and reducing the likelihood of new variants emerging. And not forgetting, of course, masks offer protection against all variants. Until we know more about the risk of Omicron, it is important to use all tools available to protect yourself as well as others. For staying with me to the end of this Shinhong Nation, I'm Elane.